Okay, welcome, ladies and gentlemen. Um, Welcome to the training of the use of CareNiche HMO software, organized by Prepaid Medicare Services Limited. Um, CareNiche HMO is a software solution that is being used to handle the management of your HMO, your clients that are under the health insurance scheme. And the name of the software is CareNiche, actually. And I will be your instructor today. Ejolajide is my name, and I'll be taking you through the platform. It's a recorded training, and you can be able to view it over and over and over again. You can also ask questions by posting comments on the tube, on the video, or on the YouTube comment section, and you can also call in to Prepaid HMO. You will have support from the IT staff on how to handle the issues that you have. Today, I'll be talking about accessing CareNiche, that is majorly logging on to CareNiche. I'll give you general introduction of the interface, how you work with the interface. I will show you the enrollee and how you navigate your way around the enrollee module, the things that you can see. I'll show you how to request pre-authorization code, how to prepare your bills, as in that is fee for service, and then you submit your claims. And then when it's paid also, you can get to see how it has been paid. So let's dive in. I'll start by explaining to you that the CareNiche software solution is actually a web-based application. That when you say web-based application, it means that you need a web browser to actually be able to work with CareNiche. And okay, you are seeing the interface. Let me take you from the beginning. We have the login screen. If you can see, you notice that the name of your HMO is there. That's Prepaid Medicare Service Limited HMO 30. And then before you are brought in, they would ask you to provide an email address. The email address you have provided, check inside the inbox of your email address. You will see password that will be generated once you are onboarded. If you don't find the email inside your inbox, then you can check your spam box. It is very likely that your email service provider flagged it as spam. So what you can do is, once you see it inside your spam box, mark it as not spam, so that subsequent mails that you get from these services, it will not be going into your spam box. It will be going directly to your inbox. If you take notes, the URL is prepaid because the name of the HMO is Prepaid Medicare Services Limited. So it's prepaid, and the name of the software is careniche.com.ng. So once you have prepaid.careniche.com.ng, you provide the username and the password that is given. In this case, this is my username and my password has been typed into the system. So once I do that, I click on sign in. The system automatically takes me into the platform and I can start my activities on the platform. As in, notice, as when I get in, as in the home page, we have Prepaid Medicare that is making you to know which HMO you are working on, and you are still on CareNiche. Now, the title bar has the name of the HMO. It has a toggle button. That is, if you are using it on a tab, as in you can toggle it so that you would have more space to actually work. And then, like when I say tab, a tablet, that's what I mean by that. And then you have this icon that looks like human as an user. When you click on it, it has the username. That's the person that is logged on. If you have to change your password, you can click here. When you click here, it takes you to the change password page, which allows you to be able to like change your password to whatever you want. It will tell you how do you want to change your password. Do you want to click? You can click here to change your password. If you click here, it will ask you to put your current password, your new password, and then you confirm the new password. So current password was the password that you logged on with, then the new password and the confirmed password. When you are done, it's better you log out, even though if you don't log out in a couple of seconds, the system logs you out. The second option is if you want them to reset the password for you. That is, you want an automatic password to be generated for you. You click and you send it. Please take note that when you are actually creating your password by yourself, there are basic rules for password creation. Number one is that your password must be at least 6 characters. A minimum of 6 characters must be inside your password. Within that 6 character, you must have a capital letter, as in any capital letter between A to Z, small letters A to Z. You need at least one special character, either hash sign, dollar sign, pound sign, euro sign, as you need to put one special character. So that is the requirement. You must have a minimum of 6 characters. You need at least one capital letter, one small letter, one special character, and one numeric value. That is figure 1 or 2 or 3. As in, they call it complex password. This is to actually ensure that you are protected, because the application is audited. By being audited, it means that we are taking note of everybody that is performing any action on this application. And if there is a need to actually review an action that is carried out, the name of the person that logged on will show that is the one that posted their activity. So I advise that you keep your password private and then always log out when you are not doing anything. How do I log out? That is the third part, which is log off. Once you click on the log off button, it takes you out of the application and you are done with the application. So if you want to go back to that, your home page, you click on dashboard and we are back. Notice we just have some few analytics. More analytics will come below as and when required, but the few analytics that we have presently are your formal, you have your formal, and then so like I was saying, as in this is the few analytics that we have for now, which tells you the number of enrollees you have, formal sector, informal sector. I explained that, the PA codes you've generated, the bills that you've submitted, the ones that have been vetted on the platform. So basically, and then we have the menu bar. The menu bar is actually where you trigger most of your actions from. Now, we have enrollees. Enrollees are formal sector and private sector. The formal sector are enrollees that are directly under the NHIS scheme. They are using the NHIS tariff. So as in, these are your basic employees of your federal government parastatals, and so on, that are under the NHIS scheme directly, or the T-SHIP scheme, as in are using the NHIS billing. And then we have the private sector enrollees. Those are the ones that you have your arranged method of billing with your HMOs. So these are the two options that you can. In this case, you see that I have only 3 enrollees on formal, and then I have 510 enrollees on private. That is the number of enrollees that belongs to that particular provider. When I click on it, it shows me some basic information about the enrollee, and then the name of the provider, the health card number of the enrollee. So basically, this is the private, and whatever you see on the private is also similar to what you see on the formal. The formal sector shows you the name of the enrollee, and then whether it's a principal, spouse, or child, the organization the enrollee belongs to, the provider, the gender, whether male or female, the date of birth of the enrollee, and so on. So Basically, you can easily look through and release this way. So I can go back to my private, and then the next thing is somebody comes to you and he says, I am an enrollee of so hospital, let's say Standard Hospital, as we can see, and he says, my name is Ibrahim. You can actually check Ibrahim, and then you press enter. It searches the platform and it gives you everybody that is bearing Ibrahim. There are 27 Ibrahims on this platform, so you can actually be able to identify the Ibrahim, right? And then be sure that they are actually an enrollee. Now, let's just assume that the person is Ibrahim Farida Hamid. As in, the next thing is I want to, like maybe I'm requesting for a code for Ibrahim Farida Ahmed. I click on that name. That's all I just need to do. If you need to request a code, now I'm taking it to the step of requesting for a pre-authorization code. You can, there are two ways, or three, four ways, a couple of ways by which you can request for it. Once you have searched your system and you have confirmed that that person is on your system, the first thing is you can place a call through and request for your code. There are numbers that have been given to you by prepaid already that you can use to actually request for your code. The second option is for you to send an email requesting for your code, or third option is send SMS requesting for your code. Then the fourth option is this can be a bit faster for you because you can present your communication straight away from here. Now, I was using a name before, okay, by Ibrahim Farida Ahmed. I click on this particular individual, and then I want to like generate. So here you can see some of the details of the individual as you might want to see. And then you can go further to say, I want to generate a PA code for this particular individual. To generate the PA code, you click on generate PA code button. So it generates for that particular individual. You can pick whether you are referring. If you are referring, you pick. If you are not referring, as in if you are just using your hospital, you just use, as in you use your hospital. Like in this case, I'm using my hospital. I pick the hospital. I select the treatment type. As in treatments have been, the reason why you are actually attending to the person, as in what the person came for, was it maternity service, inpatient, immunization, HIV management. Let's say the person is a child, I just say pediatrics. Your diagnosis, you put your diagnosis here. I'm going to say XYZ. The reason why you want to refer the person, as in if you are not referring, you can actually ignore reason for referral. Expected intervention, that's exactly what you want to do for the person, whether you want to give drugs, you want to give IV, you want to do whatever. And then your email, that's the email you are expecting a response from. Your phone number, the phone number that you want the code to be sent to when it is generated. So make sure your email and your phone numbers are correct, because when the codes are generated, it comes there. As in already, you can see the name, the address, the age, and all those things. That one is automatically computed by the system. And once you do that, you say create. Once you use the create button, okay, let me just change this to not chosen. Not chosen is so, and I create. So once I run that create, it tells you your PA code has been submitted and will be attended to shortly. As in, so presently it takes you to this other page. Now this page that it took you to is the PA code pages. If you have generated PA code before and you want to see the PA codes that you have generated, you can just come under the menu, PA codes. Now I am going to another level. I've entered into the history of your PA code. All the PA codes that you have generated before, you can actually be able to see it here, whether it's formal or private. As in, You have all your PA codes. These are all the PA codes that have been created, formal PA code or private PA code. And then, so when it is approved, you will see the PA code number here. However, you would have received a mail telling you the PA code also, and you will receive an SMS also from your provider. So basically, that is that. Also, I want to talk about tariff. Your tariff is already on the system. We have the formal sector tariff. That is the tariff of NHIS generally, as NHIS have spelled out. Meanwhile, you have the tariff of your private. That is your own tariff that you are using. For instance, I can just click on drugs and I will see the tariff, as in it's loading the tariff of drugs. So make sure that your tariff is harmonized with your provider. So this is an example of tariff, as in we have 513 drugs. So there are different categorization of tariff, drug, treatment, then whether it's admission or term services and special services. Finally, I take you to the point of preparation of claims. As in, to prepare claims, I pick prepare claims. And by default, all the claims that have been approved, as in all the um, referral code that has been generated comes in for you to prepare your claims. So when you click on this, you will see the provider, which will be your provider, because it is only your provider that you will see. And then you click on your provider. When you click on your provider, as in, before I click on the provider, let me just show you briefly, as in saying that there is just one provider here, as expected, and it's your provider. Under your provider, we say you have 15 bills. So that means that for that month of July, there are already 15 bills that is supposed to be serviced. If you want to preview the bills, like you are not yet ready to work on the bills, just click on the view button. It will show you a drop down that is actually reviewing all those bills. As in, so these are all the 15 items that are there. However, if you want to actually now check what is on the bill, you click on the bill. Like if you want to prepare the bill or whatever, you just click on it. Now, this is an opportunity to work on the bill. So to work on the bill, if you want to remind yourself the purpose of issuing the bill, you can still click on the bill. When you click on the bill, it will give you all the details that were submitted at the point of referral for that particular bill. And once you have seen the details, it can help you to now prepare your bill. Now, here is prepare bill, while this one are the items that you have added to the bill. So you can prepare the bill at once. You can be adding item one after the other. And with this button, you can always check how many items have been added to the bill. Currently, there is no item here, so nothing has been added to the bill. The application uses intelligent billing system. So once you click on add bill, it will automatically go and use your own billing method. The blue button is the add bill button. And once I click on it, it opens it for me to add the bill. Now, so it comes in and it loads all my drug list, everything that I've listed on the drugs, it loads it for me, as in from the beginning to the end, which makes it easy for me to actually be able to trace. Like so, as in, if for instance I give paracetamol, I'll just say paracetamol. As in, when I say paracetamol, it gives me all the paracetamol that I have. Like maybe I want to use 500 milligram caplets, I will just press that, and then I would decide to specify the number of pills that is the patient is supposed to take. Let's say 2 tablets, as in the frequency of use, that is TDS 3 times daily. The number of days that is supposed to be used, I can say just use it for 3 days. And then I don't need to enter the quantity. The system calculates the quantity for me. And then how much am I billing for those things? I put my figure here. Let's say I decide to say it is 90 naira. I just put the 90 naira. And then if there is any reason why you are going out of the norm, you can put it as remark so that whoever is vetting the bill will understand why you are not following the normal expected charges. And then you add. As I'm not going to add it to this bill because I don't want to add it to this bill. When you add it, it starts listing the items here, and then you see all the items listed here. And then once you are done, as in this billing period, because we are in the month of July, as of the time I was making this video, is showing that it is a billing period for July. And once I submit it, it is gone. As in, I will no longer see it on my prepare claims again. It is gone. As in, I can't work on it, I can't edit it. But if I want to, like, I'm not yet done with the bill, you can just leave it. Anything you add to the bill remains on the bill until when you finally click on submit. So if you don't click on that submit button that I showed you, the bill will still be with you. Once you have submitted the bill, then it comes to submitted claims. As you can see, there is no submitted claims in July because I didn't submit it. So this is basically how you navigate your way through it. If you have any question or further comments, if you've watched, I advise you to watch the video over again, maybe like twice or three times so that you'll be able to understand how it works. If not, then we'll see how we'll handle that. Thank you very much for your time, and God bless you. Okay.